Camera on. Come on in. You are called to the rest home, nursing home, of an 82-year-old male patient with lower abdominal pain and difficulty urinating. You have arrived on scene.
Okay, so scene is safe.
Scene is safe.
PPE is on.
Yes.
COVID screening is negative.
Negative.
Not in a nursing home in Moncton, I'm assuming.
No, not Moncton, not Campbellton.
Good. Is there anybody else in the room with us?
Me and one of the nurses here at the rest home.
Okay. And my general impression of our patient?
Yeah, you walk towards your patient, you find them holding their belly, 82-year-old male patient, lower abdominal pain, and they're also complaining of difficulty urinating today.
Hi there, my name's Marley, I'm a paramedic. What's going on today?
I just got this really bad pain happening today.
Yeah, in your belly?
Yeah.
Do you know where you are?
Yeah, I'm in my stupid nursing home.
Yeah. What's your name?
Jeff.
So he's speaking with me, so his airways, patent. Do I notice any like labored breathing or it just has
No, just an increased rate, but not labored.
Okay. Jeff, do you mind if I feel it for your pulse really quick?
Yeah.
Find a rapid pulse. It's strong and regular.
I'm gonna ask my partner to get some vital signs. So when did this pain start for you today? Or has it been going on for a while?
The pain I just kind of noticed when I got up today.
Okay. Did it wake you up? Or you just noticed it when you got up?
No, I just got up, had some breakfast, and it's not going well for me today.
Okay. So you feel like it came on kind of suddenly or more gradual?
Well, I don't know. It's not like super strong pain. It's just I feel bad today.
Yeah. Okay.
And I can't use the damn washroom.
That's frustrating. Have you ever felt this pain before?
No, not like this.
No. Okay. Does anything make your pain better or worse if you were to move around or move your arms?
Nothing
Changes it? What if you lay down? Does that change your pain at all?
I don't like laying down. This feels better when I'm sitting
When
like
you're
this.
sitting forward? If we were to lay you down, do you think that would make it worse?
I'm a little nauseous,
Yeah.
so yeah.
Can you kind of describe what it feels like?
It's just kind of all over.
Can you point?
Like all kind of lower, all over there.
Okay. And is it like a dull, an ache, a sharp pain?
Like an ache.
Do you feel any pain anywhere else? In your
No.
back, in your shoulders?
No, not right now.
Any tingling in your hands or feet?
No.
So you feel nauseous. Did that start along with the pain?
Yeah, it's gradually kind of gotten a bit worse.
Yeah. Have you thrown up?
No, not yet.
No. You're not coughing anything up either? No. Okay. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever felt, what do you think it's at right now?
6.5.
Did it start at a 6.5?
Gradually got up to there. It pretty much started at like 4.
Okay.
Getting a little bit worse.
Okay. Do you have any allergies?
No.
Are you on any medications?
I don't
Yeah.
remember.
The patient here on the list that we have in the nursing note says thiamine, metoprolol, and Elavil. And there's another note there that said the patient's been having a weak stream, so sometimes periodically able to urinate, but not very much.
Okay, so do you know what you take those medications for?
I have high blood pressure. I don't know if some of them are used for my UTIs, but sometimes I have those.
Okay.
And I don't remember.
Yeah, the nursing notes here also say prostatitis
Okay.
and liver cirrhosis as well.
What color is the skin
Paler.
when I know that? Okay.
Yeah.
Okay. Have you ever been diagnosed with any seizures or strokes? Don't have any mental illness and anxiety, depression?
No.
Any heart conditions?
Nope.
Never had a heart attack?
Nope.
No.
Healthy as a horse.
Has anyone in your family have ever had a heart attack or anything like that?
Not that I can remember. Maybe some distant relatives, but
Okay, so just the hypertension then.
yeah.
And do you have any problems breathing?
No.
No asthma, COPD, like that? Okay, any diabetes?
Nope.
Okay, so liver cirrhosis, you have UTIs, prostatitis, hypertension. How have your pees and poops been lately? I know you have had trouble
Yeah.
urinating
I haven't been able to urinate for a couple days now.
on a couple of days. Is there any pain if you try, or just nothing will come out?
Yeah, and like nothing's coming out. Just little dribbles.
Okay. And how about your poops? Have they been normal? Can you go?
Yeah, they're pretty normal.
No changes in color, frequency?
Every morning after I have my coffee.
Okay. What did you have to eat last?
I had a coffee this morning. Last night I had a couple rum and cokes with the buddies.
Yeah.
Playing cards.
That's great. They let you do that here.
They have to.
Do you drink often?
Yeah, pretty often.
Every day, you'd say?
Yeah. I mean, getting old. Might as well enjoy it.
That's right. Do you smoke?
No.
No smoking? Have you ever smoked?
I did when I was younger.
For a long time?
For like 10 years.
Yeah. Okay. And when's the last time you visited your doctor?
I came in to check on me 2 weeks ago.
And what did he say? Or she?
Everything was good. Just gave me a refill on my meds.
That's good. And in the past, few days, any colds, flus, or fevers, how have you been feeling?
No, nothing in the past few days.
No? Just normal? Up
Yeah.
until today?
Yeah.
I'm just going to do a quick physical assessment if you don't mind. I'm going to try not to aggravate your pain. Just going to check your pupils. If you can look straight at my nose.
And Aaron, would you let her to do like blood glucose and those types of things?
Yeah.
On you? Is that okay?
Totally.
She can do. Want to do the full set of vials, the 4 lead, if she doesn't mind.
Thank you.
I know we don't do that, but for this one.
Okay, so just look straight ahead at my nose. Okay. And any abnormalities there?
Nope, pupils are pearl.
Okay. And is he still pale?
He is.
Okay. Any diaphoresis?
And some noted, yes.
Okay. Can you look over here for me? Turn your head, and then the other way. Do I notice any JVD?
Slight JVD noted.
Alright. I'm gonna take a deep breath in and out. How's the chest excursion?
Good chest excursion.
Did that hurt when you took a deep breath?
No, it just made me a little nauseous.
Did it? Okay. I'm gonna push on your chest if that's okay. Does that cause you any pain?
No.
And I know everything's stable. Any
Stable.
scars, rashes, or lesions?
No
on
scars,
the
rashes,
chest?
lesions.
Okay. So I'm gonna listen to your lung sounds. If you want to keep leaning forward, I'll just listen to them on your back so you can be a little more comfortable there. And then just take a breath in through your mouth when you're ready. And out. Couple more, just take your time. How does lung sound?
Lung sounds have a slight wheeze.
So sorry, Jack.
Slight wheeze towards the bases.
I'm just gonna listen to your heart, if you don't mind. Right under your shirt. And how does his heart sound?
I don't know what those.
Okay, do you mind if I inspect your belly?
Nope. Have at her.
So if I expose, do I notice any scars, rashes, or lesions, or protrusions?
No, just some distension noted.
What's his weight?
The weight of the patient is about 240.
Okay, I'm gonna just push on. Where did you say it hurts more? Down a little
Kinda
bit lower?
yeah.
Okay, I'm just gonna feel the top to start. Does that cause you any pain?
Just feels kind of bad, but not that bad.
Painful or nausea?
Both.
Okay, I'm gonna push down lower.
Yeah, it hurts a little bit.
Okay.
More pressure with your palpation, midline, lower abdominal area.
Okay, say that one more time.
Yep. So middle, lower abdominal area.
That's where it's hurting. the
Pressure with palpation. Yep.
I'm gonna try to percuss.
And it is a male patient, just to
Yeah.
clarify that. Okay.
Yeah. Things are a little different here
Yeah,
in this
exactly.
scenario. Anything abnormal in percussion?
No, maybe some hyporesonance or dullness towards the area where the pain was palpated.
Okay. And I'm just gonna listen to your belly if I can. I'm just gonna.
Yep.
Learn with the belts. And how the bowel sound?
The bowel sounds are normal, around 30 per minute.
30 per minute. Okay, I'm just gonna check down here. Do I notice any incontinence?
No incontinence. A bit of a
Darn.
smell of urine though,
Yeah.
noted.
Okay.
Yep.
Any pedal edema?
No pedal edema noted.
And can you push down my hands? And pull back up. Okay, and cap refill.
3 seconds cap refill.
Okay, and I'm gonna get you just to squeeze my fingers as hard as you can. Squeeze, squeeze, squeeze. Okay, all good there.
Able to do so.
And I'm just gonna check cap refill. All good there.
Good there. Pulse motor sensation.
Okay. Partner. Oh, you continue.
I was
on.
just waiting for you to finish the physical.
Okay. All right. Do you have any other
Do
vitals?
you have
at
a
this point?
preference for finger?
Yep, I'll give you the vital signs. The pulse is 120 regular strong. Blood pressure 111 on 73. Temp is 37.8. Blood glucose will be 13. Sats are 94%. Breathing 24 times per minute, and I'll provide a 12 lead or 4 lead for you very momentarily.
Okay, so this patient has no ST elevation or depression that I can see, but he does have elevated and peaked T waves, which would indicate that they have excess amount of potassium, so he could have hyperkalemia going on there.
Perfect. Can you give us the differentials now in your treatment plan?
Yep. Okay, so Jeff could have renal colic potentially, but he didn't really describe it as like a pinpoint, and it's not really like one side or the other, which, I mean, he is having trouble urinating, so it's still kind of a potential, but
Yeah.
so renal colic could be one. He could have appendicitis, just inflammation of the appendix, although again, it was like, he's rating it like a 6, 7 on 10, 6 on 10, so I would expect it to be a little bit higher in pain if it was that going on. It could be gastroenteritis, just a lot of belly pain. I wouldn't expect the urinating problem with that, but it could certainly cause him like visceral abdominal pain. He hasn't thrown up yet either, which you might expect to see in that, and he doesn't have a temperature yet, 37.8. And it could be a bowel obstruction, although I did hear normal bowel sounds, and he doesn't have smelly breath that I noticed. Well, there's only breath anyway. Wasn't anything obvious. And it could have been cholecystitis, but again, he wasn't feeling pain up here. It was actually more way down here, so I kind of wouldn't rule that out. So he does have liver cirrhosis, so I mean, obviously there's some damage there, which could cause him problems. Could have something's blocking his urination, so like it could be renal colic, I suppose, but where it's like more diffuse, I'm not totally sure. Could be like his kidneys could be inflamed or anything. I'm not really 100% sure, but I would like to treat him for his nausea and for his pain. So I think we'll give him some Gravol, just go through some of the contraindications with him.
Perfect.
And some Toradol. I'm not going to give him Toradol because I'm going to call an ACP to see if they can provide him some pain management.
And why can't you give Toradol? What's the main contraindication?
Well,
Right.
he's over 65 right away.
Correct.
So I'm just gonna. Can we grab some Gravol?
Yes.
For this patient? I actually have it saved in my favorites. So
Perfect.
I'm gonna go down to contraindications for him. Jeff, that you know of, are you allergic to any medications at all? Gravol, Benadryl?
So
He doesn't have an altered or depressed level of consciousness. Do you have narrow angle glaucoma?
no.
And he's not a neonate, so I'd say you're safe to give him. I'm gonna give him, it says 12.5 to 50 milligrams IV or IM. And he is a bit older, so I think I might just start with 25 and see how that helps him. And after, 20 or 30 minutes, if I give it to him IM, he does not feeling better, then I'll give him another 25. Or I could give it IV and just reassess him in like 5 minutes. We'll do IV, so it's a little quicker. I would just kind of rely on an ACP to provide him some pain management if we could. So I think we'll transport him after we give him some Gravol, or maybe we'll get him in the truck and then we'll give him some Gravol.
Sounds good.
Start an IV.
It's 2.5 milliliters, so 25 milligrams diluted in normal saline because we don't want it to burn.
Thank you, partner.
No problem.
Will you grab that shirts container?
Yes.
So I'm gonna take off the blunt. Shirts container. That on there, and then I'll push that into our patient.
Is there anything you could tell your patient at this point while you're administering the medication? Any thoughts? Anything?
You might feel a little bit of a sensation when that's going in your IV line. How does that feel, Jeff?
Stings a little bit.
Stings a little? That's normal. And then I'm gonna just, and we're ready to roll. Well, just let me know if you start to feel a little bit better. And if not, we'll give him a little bit more. And we're on our way to the hospital. We'll keep checking his vital signs. Hopefully meet up with an ACP for some pain meds.
ACP unavailable.